Okay, welcome back, ladies and gentlemen. We are going to start now, and the presentation is on the healthy food style, and we'll continue our presentation. We were discussing before that what are the healthy diet and what is the like overweight and obesity indexes. So we discussed those indices. Now let me go and let me. Again, I have the problem in the uh, just a minute. How I can make it full. Okay. The measurement.
डॉक्टर साहब मुझे एक क्वेश्चन है ये डाइट के बारे में वो ये कि the food we eat even the oil if you're going to use a vegetables oil or any oil if it goes on a high temperature they turn into saturated fat anyway. So what do you think about our food? Like you said, olive oil or vegetable oil and all these oils here in a good food, but the temperature, when it goes on a high temperature, they all turn into saturated fat. So how we should deal with that?
So, Mr. Anwar Iqbal, we need high saturated fatty acid, long chain, short chain, medium chain fatty acid, all types of fat we need, including the animal fat. Like for example, somebody discussed about the yolk, egg yolk. Egg yolk is not a vegetable fat, it is an animal fat, but we do need that animal fat as well. So we need the total cholesterol, and you cannot consume. We recommend that the total cholesterol, like including the good and all bad. So 75% should be what you call the bad or not a very good cholesterol, and at least 25% should be good cholesterol. That ratio should be maintained. Don't worry that every fat you have to select that I should not eat ghee. For example, if you are taking butter, butter is a component of keto diet nowadays. So, but if you are these high density lipoprotein will protect your heart. So that should be minimum 25% of total fat, total cholesterol. So if you look or your lab report about the total cost, can you see my screen, everybody?
Yeah, I can see your screen, but basically we are talking here ghee, for example. Ghee is a saturated fat. And it comes in a bad cholesterol.
Bad cholesterol, yes.
But at the same time, you put vegetable oil and the olive oil in a good cholesterol. But when the vegetable oil and olive oil goes into high temperature, they become saturated fat. So what's the difference between ghee and this saturated fat as a result of high temperature?
You are referring to the cooking method?
Yeah, any
frying
method. Like if you take vegetable oil, for example, or olive oil uncooked, it is a good cholesterol. But if
comparatively, yes.
Yeah.
Even after the frying, it remain the good. It is not very bad.
I don't know what. Maybe you are right. I may be wrong, but what I know is basically when it goes on a high temperature, they turn into saturated fat.
That's correct. That's correct. The saturation increases with the prolonged cooking, and even the saturation becomes worst. Even those oil as well. Like they also, if they are saturated, they become super saturated with repeated frying. Therefore, the Health Canada monitor here those who are frying the samosas, they cannot fry, like for example, more than 5 times or something. There is a limit for that. So irrespective whether it's a good cholesterol or bad cholesterol, repeated frying make it high saturate.
Okay.
Okay. So I will discuss you with some, but you are right that the raw oil, they are better, but we cannot always eat the raw oil. Okay, we can eat in some salad, but not always. I think the woman can comment on this one, but for frying, we should try to use minimum fat. The overall idea is that minimum quantity of calories we should use. That is the more important than just calculating every day. You cannot calculate that it is a good fat or it's a good cholesterol or bad cholesterol. What is the quantity? But if your diet is balanced and you are taking low amount of diet daily, if you feel hungry, then it's a sign of good health. If you are like there is no hunger and your appetite is depressed, it is a sign that you are not taking good diet or you are taking extra fat. Another point is the apple and pear body shape, and that is also important. That the studies have shown that the truncal obesity, especially common in Indian and Pakistani population, that goes more with the heart diseases, and therefore it is now the Health Canada and Heart and Stroke Foundation, they have recommended it is not only the total body weight, it is also the distribution of the fat. It is important because the studies have proved that this distribution is a risky distribution as compared to this distribution, although the both suppose both women weight is same. So in men and women, these are the time you can take a screenshot if you want, but this is important that it should not be more than like the waist circumference. If it is 104, 102, yes. Okay. Can you please mute your mic, Shaukat sir? Okay, 102 or more than 88. So that is a risk for the heart disease. And the waist circumference ratio, if it is more than 0.9, that is a risk for the heart disease for men, and 0.85 for women. Okay, and it's very simple that you take a measuring tape and you measure your waist and then you measure at hip and then make a ratio. Okay, so waist divided by hip ratio, and that will be. Metabolic syndrome is basically a combination of the syndrome that can cause some problem in the population, and that is basically central obesity, what we have discussed just now a while ago, the apple shape and the pear shape body, and then the triglyceride and the good cholesterol, and then total cholesterol. And we said that the ratio between the total cholesterol and good cholesterol should be less than 4. So it means that at least your 25% of your total cholesterol should be good cholesterol. Okay. More good cholesterol, it's good. It doesn't mean that you should not take the so-called bad cholesterol. You can eat bad cholesterol as well, as long as the ratio is maintained. You should control your blood pressure. If it is high, go to your physician. You should control the fasting glucose level as well. Glucometer, uh, like handheld, home manometer or the blood pressure monitor, everything is available now. You don't have to go to the doctor. Even if you're going to the shopper, you can check your, or even some other like the Rexall pharmacy, you can check your blood pressure. Okay, and it is important that you frequently check your blood pressure. Annual physical exam.
दरअसल मेरे क्वेश्चन ये है कि आपने अभी जो चार्ट दिखाया था, the chart you just showed is basically just want to know is is same for all ages, or it can change with the age? Like if somebody is over 70 and if that person has 140 and 85 blood pressure and fasting glucose is around 6 or 7, is that good or not?
Basically, your question is a good one. The parameter deteriorate with the age a little bit, but
Okay.
and along not only the age, also with the diseases. For example, guideline for the blood pressure control for the diabetic population is lower as compared to the non-diabetic. Okay.
Mhm.
Similarly, for the elderly, you can just think that 130 by 85 can be taken as a normal blood pressure. So let me explain you that what is the current guideline. So the guidelines are given by Heart and Stroke Foundation, Canada. Okay.
Mhm.
So guideline, basic guideline, basically we are talking about. So we call the normal blood pressure. So normal. What is normal? And then we have uh, the uh, pre-hypertension. So my eraser. Okay, so what is the normal blood pressure? And then we have pre-hypertension, and then we have hypertension or blood pressure. So the hypertension is irrespective of the age. If the blood pressure is more than 140 by 90, then we call it hypertension. And your normal blood pressure should be 120 by 80. Okay. This is the normal blood pressure. And pre-hypertensive, all the reading, like for example, 130 or 135, or here 85 or 88. These are, we call it pre-hypertensive. We don't label it. However, having said this, the diabetic, they come in the pre-hypertensive. Like for the diabetic patient, they recommend that they should not go to the 140 by 90. They should keep the blood pressure lower than 140 by 90. Okay.
I think my question was, I think I could not explain very well. I was asking that the guideline for the normal blood pressure is for every age, or with the age normal blood pressure can change, or it always remain normal 120/80.
So it is for every individual. So like,
Regardless of their age.
pardon?
Regardless of their age.
Regardless of the age, you said.
Regardless of their age, yeah.
I think what Dr. what Anwar Iqbal is trying to say, and the same question I have. I was told that above 65, normal is not 120. It is somehow, whether it's you have a, whatever the issues we have, or maybe a normal person, but the moment it crosses 65 plus, the normal becomes 135 or 40. That's what his question.
Thank you, Himanshu. This is exactly what I wanted to know.
Well, I think
Yes.
I will comment
So
on that.
basically, you can go, Anwar Iqbal Saab, up to this range, 135 by 88. You can go up to 139 by 90. But by default, if you are crossing, although your blood pressure due to the stiffness of your artery at elderly age, it will be more. So the normal could be in your pre-hypertensive could be normal for you. Uh, so you are right. That's fine. But however, there is a more risk of coronary diseases at that age. So it is better that you control the blood pressure rather than it keeps on going that it is up, process, degenerative process with their age. So they have, yes, they have a guideline for the, depending upon the mean pressure on the population, age of the patient, but they have not changed this guideline. Like 140, you cannot say that 70-year-old man, the blood pressure or hypertension diagnosis would be 145/95. So this is wrong. Uh, well, regarding the normal level, you can increase from 120 to 125, 80 to 85, or 130, which is obviously, these guidelines are in a younger population, they are called pre-hypertensive, but probably at your age they won't be coming in the pre-hypertensive. Okay.
I think, Doctor, I think a simple answer is these are the figure for all ages. The only thing is saying if anybody is having a 120/80, whether it's 80-year-old or an 8-year-old child, is normal.
That's what I, for the hypertension. If it is 140/90 at any age,
Yeah, it is
then he is
hypertension.
diagnosed as hypertension or more. But I was trying to answer Mr. Anwar Iqbal question that the normal range can be variable in elderly. Yes, I agree with him. Okay, so but I'm coming to the annual.
Can I ask you a different question? If it's 140/70, for instance, then what is it?
140/70, then it is something what cardiologists can decide. Because if you are interested in that, then I will just give you one example. So you said 140/70. Okay. So if you minus it, then what is the answer? It's a good like question. So what is the answer?
70.
70. And if the blood pressure is 140 by, let's say, if you make it 60, then what is the answer?
80.
And if the blood pressure is 120/80, then what is the answer?
40.
So this is called normal. I have to tell you the medicine now. Normal pulse pressure, we call it normal pulse pressure. And these readings are called wide pulse pressure. Wide pulse pressure. And these wide pulse pressure, they are indication of some disease, underlying heart disease. So this is the answer is, so you can see that the normal pulse pressure should be 40. So if it is widening, then like the difference between your systolic and diastolic blood pressure, it means the this pulse pressure has been from 40, it has gone to 70, or it has double 80. So it is an indication of some disease.
Dr. Saab, if somebody has 140/100,
yes,
you still have 40, that's not normal.
So 140/100 is hypertensive, but
No,
regarding the pulse
according to-
pressure, it is normal. Yes,
Yeah,
you are
okay.
right.
Yeah, so
He
it
has
is
blood
not
pressure,
indicated.
but normal pulse pressure.
Yeah, but that doesn't indicate you are normal.
Yes, but not in terms of blood pressure. 140/100 is like hypertension, obviously. Okay, guys. And regarding the continuation of Anwar Iqbal Saab question, one interesting thing is that it also true for the glucose level, because the pancreatic enzyme and insulin also drops down, okay, when you grow like elderly, and therefore the exact glucose control is sometimes difficult, and you don't try to neutralize to that level which is seen in younger, like you don't expect 50-year, and you don't compare 50-year glucose level with the 75-year glucose level. So that also deteriorate. Okay. My treatment point is that I always see the age, and I will maintain a little bit above that normal, like the glucose. I don't want to control. So over controlling of the blood pressure and over controlling of the glucose is not recommended. So I hope that I answer your question now. Okay.
Dr. Saab, can I ask one more question? Sorry about that.
Sure, sure.
Is am I, correct me if I'm wrong? After, if you don't have a diabetes until you are 70, then you will not have a diabetes after that. Is this the right statement or wrong?
This is, I don't think it is correct.
Okay.
You maybe it may be over diabetes or not diagnosed by, but normally
Okay.
this is not something that then all of a sudden at 60 year you diagnose the diabetes. It is wrong.
No,
If
means if you did not have a diabetes until you are 70, then there are very less chances that you will be diabetic after 70.
no, there is no chance.
Okay.
No chances. Okay. Yes. But the function of the pancreas that deteriorate normally. This is my point. Like your blood glucose cannot. So in other words, in what I'm trying to say is that your sugar intake should be less at 75 year, so that it match. Your overall food amount should be less, so that it match with the enzymes you have in your body.
Dr. Saab, as I understood what you're saying as the answer for Amar Iqbal's question, that if one crosses 70 and he doesn't have any diabetic at that time, there is no chance that he will get a diabetic, he will become a diabetic after that. Am I right?
Yes, you are right.
Okay.
So
Thank you.
normally it is very like it is not 100%, but if something more than 95%, we call it evidence based. So in the 95% cases, no diabetic. If somebody has no diabetes, let's say up to 65 years, and you cannot diagnose. If there is a diabetes, sudden diabetes changes, it means that there is some pathology, for example, a cancer of the pancreas, that can produce the diabetes at that age.
What
But
about
not
borderline cases?
no, borderline is something that you just take care of your diet. That's it. Okay. Don't worry much about whenever you sit with the physician, then you have all the diseases coming in your mind. Okay. I'm coming to the physical examination, and you need to go to the colorectal cancer screening program, hearing screening program, vision screening program, lipid profile we have discussed in detail. We discuss about the fasting plasma glucose or hemoglobin A1C, bone mineral density, especially for women, and then low dose CT scan for heavy smoker. Only, not for everybody, and abdominal aortic aneurysm screening for every person who is living here 65 plus. Okay. Now this is also you should talk about the doctor. And before I go to show you another chart, I will say that
डॉक्टर साहब ये पिछला जो पेज था लास्ट लाइन क्या थी ये क्या है
abdominal aortic aneurysm. So we have a big vessel in the abdomen, and there is basically there are two vessels. I will show you that what are those vessels. So basically this is the abdomen. So this is the abdomen. Okay. So there is a big vessel, and this vessel is called aorta. And this is coming from the heart. Okay, so heart is there, and then this
ये जो मेन आर्टरी है ये वो है.
main artery, yes. And this divide into two artery. Okay, and one of the artery supply the penis. Okay, so that the problem, two problems appear before this problem. So the problem here is the coronary problem, and coronary problem give rise what you call the heart attack. Okay, but the first point in the body, first location in the body where the atherosclerosis or fat deposit is not at the coronary vessel. Okay, surprisingly, it is the aorta. Okay, here and in these vessels. Therefore, sometimes we call this erectile dysfunction. So erectile dysfunction, basically, that means that there is a decrease, there is atherosclerosis here. And that is the 70% causes of this erectile dysfunction is that there is a bad fat or it is being blocked. Okay, so that is the main reason for this problem. And similarly, this is we check by the ultrasound, and this ultrasound examination, it detects the thickness in the wall of the aorta. So irrespective you are a smoker, irrespective you have blood pressure, whatever the reason, you should go to the doctor and book an appointment for ultrasound. It's a very simple exam, and it is meant for both men and women. So do it, and if it is normal, then there is no need. But if it is abnormal, it means that there is a risk of this problem. Okay, to prevent that risk, you need to do these one. Is it clear?
Good, thank you.
Okay.
इसका कोई आसान नाम भी है डॉक्टर से बात कर सकेंगे
आप you can just say that I want ultrasound, and what I'm going to show you is 1 minute. I am going to show you the document. So I don't know, here in our class we have a woman as well or no?
Yes, yeah.
Okay, so there are for the woman, I will start. For the female, we have the preventive care. If you can see here, the checklist, and these are all you can fillable, like you can write down your name, for example, if you like your name, so you can fill the name. Okay, similarly, the sex, age, date of birth, health card, so everything it's you can fill. And then there are lifestyle, habit, fat, cholesterol, everything is there. And then is there any family history or hospitalization? You discuss about the cardiovascular. Actually, this form is being filled. It should be filled at your annual physical examination. That's why Health Canada pay double the amount at the time of health examination, annual physical, to the physician, because they consume more time. So you ask about that these all things are checked or not checked. Okay, especially the cardiovascular health is important. In women, the breast health and genitourinary health is also important. Alcohol, personal safety, hearing, noise, seat belts, a lot of things. But I need your attention. This is the form by the College of Family Physician. So for women, it is important that the folic acid supplement for childbearing, okay, and then calcium intake. So it is written here 1 gram to 1.2 gram or 1000 to 1200 milligram per day. Calcium, vitamin D supplement, regular physical exercise, avoid sun, and safe sex practice. These are something. And then overweight, weight management, and then there are some other, and then smoking, and then alcohol, and then elderly fall assessment, and oral hygiene, personal, and so all these are the behavioral. And then if you go to the more than 65, then you will see that there are certain investigation, and top investigation is the mammogram. Then there is a hemoccult blood or the colonoscopy. Then cervical cytology. Okay, this one. Then for the gonorrhea, if at risk, and then the other things, they are common for the men and women. And then there is a vaccination profile. So these vaccination are not for children. These vaccination for those at 65 years. Okay, so tetanus, influenza, pneumococcal, and at the time of influenza, let me clear about the COVID vaccination. So minimum 3 vaccine, 2 basic vaccine for the COVID coronavirus, and 1 booster shot is required. Okay. Then whooping cough vaccine, then shingle vaccine, and then chickenpox vaccine. So these vaccines are all recommended by. Okay. So that is the more than 65 years. Those who fall in less than 65, then they have the other profile. So any question in this one, in this pro forma? If you have any question, then
तो ये डॉक्टर को भरना चाहिए ये फॉर्म जब हम जाते हैं
exactly. And you should insist on these, like this is your right as a taxpayer, that the doctor should do all these investigation for you if at risk. So for example, hemoglobin A1C or fasting plasma glucose, fasting glucose level, the doctor should do if at risk. Similarly, bone marrow for those women who are at the risk of osteoporosis. If you are feeling some pain, if you are feeling some fracture, if your tooth count is less than 20, there is a drop of the your any teeth. If there is a problem in the bending, like there are certain tests. I cannot go into the detail of that. But you should ask the doctor. Maybe I am having osteoporosis. So they should book a DEXA scan for you. Okay. If you are a heavy smoker, then they should book a CT scan for you. So it depends upon that. Do you have, if you have problem in the hearing, if you are problem in the driving, they should book a eye examination or ear examination for you. And the same thing is also available for the male. Okay. So this is the checklist form for the preventive care. And this is again, whatever you are looking, nobody will show you. So I'm telling you that these are the real things that what. So if you go to the male patient, then certain things are common, like colorectal cancer, gonorrhea, but audioscope. Audioscope means that there is a measurement of your hearing, lipid profile, hemoglobin A1C, and then bone mineral density, low dose CT scan. And here you can see, especially for men, it is the AAA. So what is, Nusrat Saab, what is AAA?
Automobile Association.
American Automobile Association. No, it is abdominal aortic aneurysm.
Oh, yeah, वो है AAA.
Aortic aneurysm. Okay. Yeah.
Nice.
So it is recommended for every man. Okay. And then vaccines are also available. So there are certain special things for the man and something. So these are the 2 forms. If you like, I can send you these forms so that you can review these forms by yourself.
I hope मेरे डॉक्टर ने देखा हुआ होगा.
Doctor, one question.
Yes.
I know this is a standard set up by the Ministry of Health. Every doctor has to do it. Are they obligatory to provide a copy of this to the patient?
Every doctor is supposed to provide your result for this, but they are not supposed to provide the copy of. But
No,
if
but
they
on a
will
result
write
of
some,
get, but you're not sure whether he checked everything or not.
Correct.
well, it will create a lot of confusion and dispute, because you should leave something on the doctor. That's why we say that only discuss your problem with the doctor. This is just to give the trust. So we call the doctor is always fiduciary to the patient. They are always doing the best. But certain investigation, for example, you can ask the doctor, doctor, I heard that I need some shot at this age, extra immunization, or I think that my sister has osteoporosis, so I want, or my sister has breast cancer, so I want to. So if you bring in the information of the doctor, because doctor they don't know, then the doctor will definitely
Doctor,
99%.
I have an experience of both. I live in also USA, I live there. I know the both system. Here,
Doctor, I have one question.
Yeah.
If a person has so many doctors, like I mean, what they call it, cardiologist and nephrologist and so many others, urologist, or all specialized, and the family doctor said, no, you deal with those people. So to whom should I ask about this AAA form?
You are talking about the referral program. So basically what I have discussed, it is the family physician job. Your family physician.
Say you go to your specialist doctors.
If you complain that I have this problem, your family physician should refer you to the specialist. For example, you can say that, doctor, I am diabetic or hypertensive, but I have problem in my vision. I cannot see clearly. Then the doctor should always refer you to the ophthalmologist. Or if you say that, let's say I have some problem in my bowel or whatever, so the doctor will be, so then you can discuss with a specialist.
What about this AAA you said? Who is actually supposed to take this test?
This form?
Yeah, this, the last abdominal aortic.
Abdominal aortic aneurysm?
Yeah.
Mm-hmm.
Yes, abdominal aortic aneurysm. Before abdominal aortic aneurysm, you should ask one more important test. And that test is called lipid profile. Let me write it down.
Basically, cardiologist.
वो तो normal है डॉक्टर साहब, वो तो blood test में करते हैं.
Yes. So if this is the lipid profile, that's number one. Okay. And the second is the abdominal aortic aneurysm. If your age is 65 and more, so this is a guideline. If you have not gone through that, then please do. Every doctor will do it. What is the problem in that? It's a very simple test. Just a
ultrasound है ना ये तो?
Yes, ultrasound है. It's just an ultrasound.
Doctor, can I complete my question? Since the government is paying to a GP to do the annual exam and they're paying it double, right?
Yes.
So it is their responsibility to let the patient know. Now, from the vaccination point of view, what vaccine they should get when. I've never seen this thing in Canada. I also live here. Here is a proactive. They are informing me, you come on that day, this is the vaccine, you do it. So is it not any obligation or requirement from the government for the doctor to make sure that they have to inform the patient about the vaccination and the required tests as according to their standard? Because
I don't know, it depends. Actually, it depends doctor to doctor. My doctor, he had done all these tests on me even before I asked them. And as far as USA goes, if you are under the medical system, medical aid or whatever they call it, then the medical doctors are very proactive because they get the money to do that. So that is
Exactly.
that's the difference between USA and Canada.
And because of what I'm saying,
Yeah.
whether you are in USA or Canada, these doctors, family physicians are being paid twice for doing this thing. If some of the people are not informing the patient, it is very unfair on behalf of the doctors because they are being paid for that.
No, this is the
I agree
this-
with this.
this is the Shoka Saab, this is the orientation program. And I'm sorry that I told a lot of people, but they think that it is just a talk, normal talk. I prepared this presentation and these guidelines with a lot of time. Even I have to prepare my exam question, but I promise you. And the idea is that general population should be aware what are your right as a taxpayer.
Correct.
That is the main idea.
Thank you. Let's move on. Let's move on.
Okay, now it's coming to the immunization. So these immunizations are important for you, including the what we discussed about the COVID vaccine investigation. Sorry, immunization. Okay, so that's where you all know. You should know all these things, and then the vision test.
Question. I think I was told that
Dr. Shakeel Saab, I
65
have one question at this stage.
One by one. Yes.
Yeah, I was told that the people who are above 65 or have some issues require the fourth. Is it correct?
For what?
Fourth
Fourth
vaccine for
COVID?
no, not yet.
Not yet. I don't. It is a news for me. Not to my knowledge.
So far.
Maybe immune, what they call it, compromised, maybe.
No, just like forget about the general population, the guideline, follow the guideline of Health Canada. You can always go to the website of the Health Canada, whatever is written, that is the guideline. Whatever I am presentation, I'm going to show you the whole things. So for example, this is the resources and you can go to any resource and you will find the same information. So
Aziz,
whatever,
the Canadian Health Ministry follow the US one, right? And still in the USA, they have not discussed or talk about the fourth vaccine.
yes, you are right. You are right that we are not talking about.
So the shingles vaccine, is it just once in a lifetime or it has to be repeated?
Not repeated.
Depend upon what type of vaccine. Zostavax is not need to be repeated, but the Shingrix, there is a second type of vaccine that need to shot. Okay, so that was about the immunization. Now the vision. Now vision, you can go and look that if you have difficulty in driving or watching television or reading, like close or far, then you go and you get the ophthalmology referral. Whenever you go to the ophthalmology referral, make sure that he should check your pressure. It is important that they should check what we call as intraocular pressure. Okay, so we call it intraocular pressure, and that is required because this is the most common cause leading to a condition what we call glaucoma. Okay, so you should rule out glaucoma, number one, and then second is the cataract. Cataract is more common with the diabetic people, and third is the problem in the retina, your back eye. So retina problems, they are basically the age-related problem or non-age-related, mostly due to the hypertension or due to the diabetes. So this, they will dilate your pupil and they will look through the slit lamp examination or by the fundoscopic. So make sure that if you have any problem, don't hesitate to discuss with your doctor. And even it is if you are 65, before 65 year, that examination is like, for example, if your age is 40 years, Even then, this is a free examination by the Health Canada. Like anybody who has feel problem in the vision, he should be right away consult, and the doctor is supposed to refer for the specialist. Similarly, if you have problem in the hearing, then or trouble hearing, then you refer to the eyes, audiologist or the specialist. Okay. Uh, the screening of the vision and hearing is free, but the equipment, they are not free by the Health Canada. So the cost of glasses or cost of hearing aid you need to bear. Although there are some facilities available, but government does not compensate for the hearing and glasses or the hearing aid.
डॉक्टर साहब हमने तो आज
I
तक
think
आई एग्जाम जो कराए हैं, वो कभी रेफर नहीं करवाया, डायरेक्ट चले जाते हैं
Sorry?
ऑप्टोमेट्रिस्ट के पास।
Yes, no,
ऑप्टोमेट्रिस्ट के पास डायरेक्ट चले जाते हैं, हम लोग कभी रेफर तो नहीं करवाया, और पैसे उसको खुद ही देते हैं।
optometrist basically 65 plus once in a year it is covered.
अच्छा,
It is
No
covered.
anymore. Not anymore.
Not anymore.
हाँ,
Oh,
Not
really?
anymore.
No, no, they were on a strike because of this. Now they come back. So back to normal.
सॉरी,
They were on a strike. They were not doing it. But now the strike is over. So they are doing the same way now. So it's not
Yeah.
covered.
तो ओवर 65 फ्री है।
Yes, we here, right? Okay. दूसरे answering Mr. Saab question, you do not require referral for the eye test. Just go anywhere you like to do it.
For example, you don't require, for the woman, you don't require a referral for, let's say, for mammogram.
Yes.
So mammography, you don't require, you can go anywhere and they will just see your health card and do it. So there are certain facilities. Okay, I think I will stop here and I will directly, because most of the things we have discussed, and fall, I will just leave it. Some factor for the fall, it will take a longer time for me. And what are the fall prevention? That is a very common. So I will stop here and we can discuss some more question if you have. And I will share this presentation with Shaukat Saab, and you can get it from the Shaukat Saab if you want. Okay, or if you want to share